Archives of Prasar Bharati presents the timeless treasure of golden era.
Healthy mind in a healthy body. So goes the saying, but so is the fact. The concept of mind-body relationship is not entirely new, but only recently it has come to be understood scientifically. What has been found is that excess of stress and negative emotions can play havoc not only with our mind but also with our body, and this has led to what is described as psychosomatic disorders, where stress in the person's mind can lead to bodily illnesses. In today's episode, we'll deal with certain kinds of disorders which have a psychosomatic basis.
Life in today's industrialized and urbanized society may be an endless run to nowhere. The ruthlessness due to rapid change, constant hammering in on one's senses, unhygienic living conditions, poverty and social inequalities lead to social tensions and causes stress to the individual.
Psychosomatic disorders are a set of problems in which a person reacts to tension, anxiety or stress in such a way that some amount of bodily damage is caused. This damage could even be permanent. Negative feelings and stress make the person use all the body organs, and subsequently, because of emotions, a bodily disease or psychosomatic disorder gets caused.
So now you've seen that emotions can really affect our health profile, and not just the emotions which you see on the big screen, which seem to influence so many people nowadays. Because I think you can't influence yourself unless you really want to. That's what I think the term psychosomatic means. The first time I heard it and I asked for the meaning, I was told psycho is the mind, somatic is the body. So actually it means that which affects the body because of the mind.
Most of the illnesses are caused by thinking. If no tensions, there wouldn't be illnesses.
Tension only will develop all the problems to the human being. Due to tension only will get blood pressure and all the things of his body. As my joining of duty in the age of 19 years, I was good fetal condition. Now that position may not be now, and I got mental distress because my job is like that. I have to take the train in a safer manner with 110 kilometers and long distance of 455 kilometers at a stretch from Bejwada to Balasha. That also it will have mental agony on me. And naturally I may got some diseases.
In the recent past, what we have found is that more and more people are becoming prone to this kind of stress-related problems, and it's quite obvious when we see people anywhere in the community that they appear restless, they appear a little preoccupied, and they are sometimes withdrawn, they are not able to relate to what's going on. And these are the obvious symptoms of stress-related problems.
There are enormous rates of urbanization in all countries of the world. I don't think India, for instance, is immune from that. Your cities are growing at enormous rates, just as they are in other parts of the world. And in fact, I think those dramatic changes, the effects of this rapid urbanization with the things that that's doing to families, causes a great deal of stress, coupled with, of course, other things that are affecting people's health, like changes in diet and changes in daily life habits in terms of exercise and so on.
Stress plays a very important part in psychosomatic disorders. Stress can actually precipitate an attack of psychosomatic disorder, or it could worsen the symptoms, prolong the symptoms, or reduce the outcome or treatment of the disorder. Sometimes the complications may be worsened if the person continues to be stressed.
In fact, my job was so tiring, and so day to day it was so tight. So what happened? At that time I felt that I am feeling too tiring every time. I am getting stressed. The reactions which is coming in my body, I was used to get very soon tired. you see, feeling tired. All of a sudden I started getting acidity, sort of. After some time, even in a minor job, I will get exhaust.
The common complaints or ailments that we meet with in clinical practice are headaches, aches and pains, fatigue, intestinal symptoms like constipation or diarrhea, chest pain mimicking lung or heart disease.
In a general hospital setting, we see a lot of patients who present with multiple and vague somatic complaints, and they usually go to the medical or the surgical OPDs first, where they undergo various investigations. Initially they are physically examined, some symptomatic treatment is given. Later, when they persist with the complaints, various types of investigations are carried out.
To reduce medical costs and alleviate anxiety of the patient and the relatives, prudent investigations should be carried out. Yet, in some cases, it is important to do them to rule out any serious medical problems or complications. If a proper history is taken and specific investigations carried out, one could differentiate between symptoms due to malfunctioning of the body or those due to a mind that is not properly balanced.
After the investigations are done, what they find is all investigations are within normal limits, after which usually these type of patients get referred to the psychiatric OPD. It is here that we find that the somatic complaints are not suggestive of any one particular illness, but usually in the background there is some tension, some family problems in the family, or financial stressors or interpersonal stressors.
The close link between mind and body means that stress which is experienced by the mind at a mental level also affects all the bodily systems, which means that digestive, circulatory, respiratory, musculoskeletal and endocrine systems, including the allergies and other immunity disorders, are also there.
I had taken voluntary retirement from service in 1981 and taken an assignment as maintenance engineer with a company, private company in the Middle East. And there one of the factors was which gave pressure that the penalty factor in case of breakdown was 1000 riyals per minute. It was always on the escalating scale. Although the standby arrangements were there, but all the time the pressure was there on the mind that there should not be any breakdowns, there should not be any problems. And continuously for almost 5 years when I was there, not only in my workplace, even in the living conditions, this pressure was there. And I think that contributed mainly to the problem which I developed in the form of angina.
My daughter was admitted in the hospital, so I got too much tension because she was crying and only one daughter I got. So I have taken the tension, therefore hand is shivering. 2 to 3 days I am not getting motion and all, and gastric problem is also there. My stomach becomes heavy. I do not like to eat and I am not feeling hungry to eat.
See, a few years ago, we could see stress only in a limited number of people, but in the recent, say, 5 to 7 years, we see this phenomenon in more and more people specific to certain groups, certain professions, where people are displaying symptoms which are easily recognizable. The symptoms could be a kind of restlessness, kind of withdrawal in some cases, acidity problems, some cases of hypertension, which if it is not treated in time could lead to more complicated problems like stress-induced diabetes, cardiovascular problems, and many other stress-related disorders.
When one is under pressure and stress, the pulse rate rises, the breathing rate increases, one may feel sweaty and feel extremely uncomfortable. And similarly, stress, protracted stress affects the system as a whole. It affects our state of well-being, it affects our level of certain hormones in the system such as adrenaline, and thereby affects the secretion of various substances in the body.
There is research to indicate that not everybody will develop the same kind of illness under stress. There are some people who are more prone than others to develop a particular type of illness.
Stress increases certain hormones in the system which may affect bronchial asthma and trigger asthma. It also influences our gut motility, and therefore we have symptoms such as diarrhea or constipation.
People who develop what is called as high blood pressure or essential hypertension may be having a personality where they suppress their anger for a very long time for fear of losing approval and support of others. And this continuous suppression of anger subsequently leads to high blood pressure.
It increases our heart rate and therefore produces symptoms such as palpitations and may actually aggravate or influence symptoms related to heart disease.
I am doing actually manufacturing medicines and started the factory some 12 years back. Now actually after starting the factory, I developed a lot of tension and other things. When I was 3 years back, actually I got a heart attack. Before that actually I got a lot of tension and sleepless night. So based on that only actually I got this heart attack.
Normally he did not have any tension until he had this pain in the shoulders, which he himself diagnosed as a problem. Then he was informed by the doctors that it was a heart attack. He has no other tension but worries about his factory. Doctors also feel that probably this is the reason for the heart attack.
When I was admitted in a hospital, my cholesterol level is actually below the normal level. And then actually I am not a smoker as well as I am not a drinker, but actually I am not having any family history also. But slowly I developed this actually sleepless night as well as a tension. It moved to the heart attack.
Persons have become more competitive. They want to progress fast up the ladder in the shortest possible time. With such cutthroat competition, there is immense increase in the stress and strain. It is more so in the men because men are the working people. And the incidence of a heart attack has tremendously increased. Women by nature are protected at least till the menopausal age. Everybody knows that heart attack is a serious malady. It can extinguish the flame of life in no time.
It is the fear associated with heart disease that produces anxiety and also propels people towards action for an early treatment.
When a patient has a heart attack, besides his heart, he is greatly mentally disturbed. He does not know the outcome.
The stammering also it comes. Then actually the sleepless nights follows. Slowly actually I thought I am going out of control. Then it actually suddenly strikes that I am having that heart attack.
You may have noticed people who are constantly engaged in a struggle to outdo others, to compete, to meet deadlines. These people's behavior includes aggressiveness and ambitiousness. Not that there is anything wrong in being ambitious, but not at the cost of your health.
If a job was not done in time, I used to flare up. Many times I used to shout at my subordinates or my colleagues, staff and all that. I had that anxiousness all the time that the work is to be done.
So they are spending most of their life in the business or their activities. They are not bothered about their body or mind. So slowly they are developing into the tension.
And while driving my car, I used to feel if somebody comes in front, I will shout, I will rather sometimes give a big abuse also to him. It was too much telling on my nerves that I was feeling too bad. I said, what's happening to me?
Most of the people, 90% of the people are having the tension and other things because they are developing all the things, they are uniting all the things.
Even in the house, if children play or say they shout or do something, then I used to shout on them. Even my family life was getting affected.
These are people who are called type A personalities or coronary prone personalities, and these subsequently can develop heart attacks much more than the normal population.
It happens to most people when they are striving to get at the top of their career. The first episode usually makes people reflect on their lives and to bring changes, starting from dietary changes to changes in their lifestyle.
Because I'm having now exercise as well as a diet control, so I'm not getting any irritation. Moreover, when I'm getting irritated, actually I feel calm and think it actually is necessary to get into tension. I'm not getting into tension at all nowadays.
Actually, I was always all the time thinking that there should be something by which I should be able to control myself and get myself cured by methods other than the medicinal methods. I attended a camp here in Adhyatma Sadhana Kendra last year. After this program, in the month of May, I went for TMT again. It was TMT negative, which was a big boost to my moral, and I have continued with my dhyan and yoga exercises.
He has to change his lifestyle. He has to think of ways and means whereby he can reduce the mental stress without compromising the quality of his input in his job.
Recurrent headaches, or what is also called as tension headaches, at times vascular headaches, are very common in people who have some kind of emotional conflicts. The people who have anxiety or depression may also have these headaches. What is important is to realize that there might be a life situation which may be precipitating, causing or perpetuating these headaches.
The sum total of stresses within and from outside combine to become headaches.
There are various kinds of headaches, and the commonest is a vascular headache. Migraine is one of the types of vascular headaches. Other common headache is a tension headache, also called muscle contraction headache. The other common variety of headache is tension headache, and in that the major reason is tension or stress. In that the person has continuous headache all the time, which is mild, diffuse, generalized, and once the tension is over, the headache also disappears.
I'm never tense. I'm not getting any headache in the morning. Just at night, I'm getting sound sleeps. So I have got tremendously changed. Whatever I was before that tension, that period, now I'm again on the same period.
The common varieties, as I told you, are migraine and tension headaches, and these are chronic headaches which have been there for a long time, and months or years altogether. And these headaches, if you do a detailed neurological examination, and that is normal, we generally do not ask for any investigation. We start treatment. Now, in addition to specific treatment, the stress should definitely be reduced, especially for tension headache. All the factors which produce stress, as I said, physical or mental, all these factors should be avoided.
Negative emotions like anger, hostility, depression are the root causes of most of the psychosomatic illnesses. The problem is that the patient talks about only the physical symptoms.
In Tamil Nadu, what we call it as KKK syndrome, that is called as Kai Kal Kodachal syndrome. Invariably the patient will complain that he has got pain in the upper limbs, lower limbs and all over the body. But when you examine clinically, the patient may not have any medical problems. But if we spend some time with the patients and go into the dynamics of their family, invariably they come out with some psychological problems. So I feel in general practice, the general practitioner must spend some time apart from the clinical examination if he has a doubt that this may be a functional problem.
Unless the physician also tries to find out the psychological component, then the illness is allowed to go on for a long time, leading to chronicity or even complications.
The main thrust of treatment should be stress management. In addition, there are a number of illnesses where stress is a component.
The tension is to be managed. Without tension, you cannot work.
There are many ways of dealing with a psychosomatic problem, some at the level of the physician and the other at the level of the individual.
The easiest way what I have found is, and I would advise each and everybody, when you are under tension, have a deep breath and release it very slowly. within 10 seconds time you will feel the tension is evaporated and you are your normal self. Even when anger is coming, the anger will vanish and you will be perfectly all right.
In stress conditions, our stress mechanism is triggered. It results in the increase of the blood pressure, increase in the heart rate and the pulse rate, and increase in the breath rate, and such other conditions occur in our body. To meet with this mechanism, we have to learn relaxation mechanism, which we can learn through Preksha meditation.
Any meditation done regularly after having learnt it well produces positive changes, as does being with nature, exercising as a group or individually, or doing yoga, or being involved in a sport that you like. The emphasis is on doing them gradually, under supervision, but regularly to achieve a harmonious state of holistic health.
The individual must seek ways by which he can relax. The role of yoga, meditation, support from family members, exercise cannot be but emphasized. What is important is to find out the role that negative emotions are playing in one's life and try to eliminate them all, to be able to not only manage but get rid of the symptoms of that disorder.
The mind is such a powerful instrument that negative thoughts, emotions, or a stressful situation can bring on a disease even when it should not have been there in the first place, or it could have been avoided. But why even reach that situation? Why not just change our whole way of thinking and appreciate the positive capacity of our own mind to cure ourselves? That age-old cliche really holds true. A healthy body is a healthy mind.
We may not be able to vanish all stress from our lives, but definitely it can be positively channelized to make it work for us rather than against us. So look after your mind to have a supple and healthy body, to have holistic health.
Silent in your tears, wasted in your years. When you cry alone. Recourse to fantasy, living with insanity. Another night beside the phone. Put your mind, feel the pain. Seek your meaning by my watch. Cage the war within. In the bin, curl up with your memories, togetherness and harmony. Put your mind